to Slow Medicine Radio. Our host is Integrative Medicine Dr. Michael Finkelstein. Michael offers medical advice from a holistic paradigm, including both medical and metaphysical philosophies from the full spectrum of human experience. Slow Medicine Radio offers fresh ideas on how to attain a state of wellness that seems distant given the limitations of today's medical paradigm. It introduces you to thought leaders who connect the dots between theory and practice, examining health from a broad perspective with regards to medical diagnoses, conventional and alternative therapies, healthcare policy, and related topics that warrant further thought and discussion. Slow Medicine Radio does not prescribe to take this or do that. Instead, it offers an open-minded, intelligent, and practical approach to living, resulting in greater health individually and collectively. Here is Dr. Michael Finkelstein, the founder of Sunraven, the home of slow medicine in Bedford, New York.
Welcome to Slow Medicine Radio. I'm your host, Dr. Michael Finkelstein, and we're here every Monday at 5 o'clock Eastern, 1460 AM on your dial or worldwide at WVOX.com. And the point of this show is to give you an opportunity to listen to and share, actually, some of your thoughts and stories and questions about health and healing from a much broader perspective than what you typically get when you go to your doctor's office, who might measure you up and down and examine you, but in the end, really be primarily looking at your physical body. And I think most of us realize there's so much more. So this show is really to help you understand how to connect the dots. It's not to say that you don't need that doctor. In fact, I am one, and I understand exactly the benefit of medicine. But I think to be as healthy as we want and desire, then we need to consider other aspects of living, including how we take care of ourselves primarily. So today, it's me and you, an opportunity for you to call in with some questions or thoughts, maybe some concerns that you have. You could maybe use me as a second opinion, if you will. That's often what I do when I see people at Sunraven in Bedford, is to go over in detail their life, their history, their concerns, of course, their medical symptoms, but then really looking at that from the broadest perspective I can to help them understand ways that they may not have thought of before where they could really piece things together and get healthier. So please call in. Today the number is 914-636-0110 and share any of your questions with me and then others, of course. And in the process of answering those questions, I could share with you a little bit more about how this works, how slow medicine really begins to identify the different facets of our lives and how when we piece them together well, we can see the full picture. One thing that we could talk about, of course, is the current time of year and how people are lining up in centers for flu vaccination. It's one of my areas of interest, which is how to help people prevent disease, of course. And when I was growing up myself, I certainly received my share of vaccines. And when I started my practice, I was administering them. But there's a lot of concerns now about vaccines. A lot of people concerned in particular about what's in the vaccine, what it does to our immune system. Does it make us potentially more susceptible to other ailments? Of course, it was all as intended, that it would definitely prevent the illnesses for which we've been vaccinated, and there were no side effects. I think everyone would be in agreement. No problem, let's have them. But there appears to be something going on when people are vaccinated that leads for some individuals to experience new symptoms that seem very contemporaneous with the vaccination. And so it leads to that question, and people then have ambivalence about getting vaccines. So one thing I often talk about in the month of October in particular, as people start contemplating the seasonal illness, particularly influenza, what they can do to prevent it. So that's one thing to talk about. So if that's interesting to you, give me a call, 914-636-0110, and I might hear your thoughts and opinion on the subject of vaccines, any of the particular questions, and I can talk about them. In the interim, let me share a story of somebody I did see last week, something that I think is relevant as well, which is the subject of, am I taking more medications than I'd like? A lot of people come to me and say, I've been given this medication and I really don't know if I need it. And then there are many other people, especially as people get older, who wind up taking 2, 3, 4, 6 medications or more. And they're not sure they all are working. And they're pretty concerned that just like the vaccine issue, that they may be experiencing new symptoms as a result of the side effects of the medications. So I saw a woman who is about 80. She was primarily dealing with back pain as a result of osteoporosis and a couple of injuries she experienced when falling. She also had some knee pain as a result of one of the falls in the last several months. And over the last year has been getting a lot of attention to the pain, and so she's getting medication, starting with the typical anti-inflammatory pain relievers and then escalating to more potent pain relievers. And then as a result of pain medications, both anti-inflammatory medications and narcotics, she's having now stomach problems. So she's getting a new medication for the stomach problems, meaning the discomfort, the nausea that she's experiencing in the morning. Because she's 80, she's on the usual aspirin a day, which I actually think is a pretty reasonable recommendation, but she's taking that as well. And she's on a cholesterol-lowering medication, pretty typical of somebody of that age. And now, a year in, she's not feeling very well. She's in chronic discomfort. She's not able to move around, so her mood's a little low. She's getting an antidepressant. And this has all been going on and is escalating. And a few days after I was called to see her, she had another fall. And so when I finally came to her house, I actually visited her home and sat down with her husband and her 3 children. I reviewed what's going on, and this was the story. It's a common scenario. I asked her in particular, were any of these medications clearly helping? And she said, well, no, my stomach still bothers me. I still have pain. I'm still feeling sad and depressed. And so she's taking all these medications presumptively to treat and deal with those symptoms, yet the symptoms persist. And now she's having more nausea. She's not able to eat very well. She's dehydrated. And the fall that she experienced a couple of days before I saw her was a result of getting up quickly from bed, going to the bathroom, and fainting, or something that might appear like fainting. She doesn't really remember. So that happened. And then she got back into bed, and she somehow slipped out of the bed and fell down again. And so there were periods of lapses, if you will, in her mental status, her ability to recall what happened, and perhaps an experience where her blood pressure or heart rate or something changed that caused her to fall in the first place. It's quite probable, in my opinion, and my experience practicing medicine for as long as I've had, that the medications are contributing to this new event sequence and that they're not helping her. That her blood pressure may be down lower than it had been because of the dehydration that may have something to do with the medications and their side effects, not eating well, the pain, of course, but that the medications themselves could have direct effects on her heart rate, her heart rhythm, even her blood pressure. And so after spending over an hour with her and her family and giving them other ideas about how she might look at inflammation in her body and understand that anything in her life that's inflammatory, like bad news, like television these days, or things that are aggravating, like television these days, or just the pain she's experiencing, the food that she eats, the conversations she has, some of which are obviously elective, that these could all be inflammatory. So I did talk to her about addressing those. But then I got to this subject of medications. And after going through each one in detail, pretty much offered the opinion, which they accepted, which is that perhaps would be a good time to taper off these medications, none of which seemed essential, meaning life or death. Like if she stopped them today, something would happen. You can stop a pain medication, and obviously I'm not hoping people have more pain, but the downside of that is feeling more pain, which maybe can be temporized another way. You can stop a medication for nausea, and the worst thing that happens is you remain nauseated. These aren't necessarily, again, things that I hope people have experienced, but that's different than an essential medication, like one that controls your blood pressure, which would otherwise be sky high, or your heart rhythm, which would otherwise be chaotic, or prevent you from having a heart attack or things like that. Those are medications that you can't just easily stop. But fortunately for this woman, she was on medications that I felt could be stopped, and to see what happens. And of course, it's only a couple of days into this, we'll call it trial. But my hope is, because my experience has been, that when people do that, particularly older people, when they stop non-essential medications, all of a sudden have a shift in how much energy they have, how clear their mind is, how their mood improves. And what's interesting about it, some of the chronic symptoms, including pain, seem to stabilize. They don't get worse. They may not necessarily get better, but they don't get worse, which surprises people. So without the medications, they may not be experiencing all the relief that they may hope for and may one day be possible, but the downside isn't as dramatic as they feared. And so they feel better in mind as they clear their body of some of these medications and the rigor and the confusion that often goes into being obligated to take medications like that. And so this is what I don't advise for people to do independent of medical advice, but I do think that it's an appropriate conversation to have with your doctor if you're finding that your symptoms persist even though you're taking medications. A medication is great if it immediately eliminates a symptom, then you know it's working. And if that symptom relief persists, meaning you stay well. But for things that are chronic, often those medications lose their effect, unfortunately, and maybe worse, they start interacting with other things. And this is what typically happens as people age. They acquire new symptoms. They have aging phenomena occur that are symptomatic, and with good intention, doctors try to alleviate those symptoms, but if it doesn't work all that well, then it actually could backfire. I wonder if you have a story like that yourself or you have a question. The number again is 914-636-0110. Let's take a break now, and while you think of a question and can call in, and I'll field those. Again, the number is 914-636-0110. And just to have you think about one more thing, maybe put in your calendar for this Saturday, October 22nd, an open house at Sunraven in Bedford, where I work. We'll have a fall festival, if you will. We'll have some of our honey and our bees out on display. An amazing display case. We're going to have some teas that we make, a tour of our garden and our home and kitchen. We'll have some food that we prepare. There'll be some music. There'll be an astrologist, a dream weaver, somebody who helps talk about dreams, a man who talks about financial and spiritual health, all members of the Slow Medicine team there to meet and greet. Also an opportunity to raise funds for the Slow Medicine Foundation, which in part sponsors this show. So I hope you support us by coming to Sunraven in Bedford, October 22nd from 10 to 4. So now we'll just take a break. The number is 914-636-0110, and we'll be back in a minute.
You're listening to Slow Medicine Radio. You can find out more about the show and the work of Dr. Michael Finkelstein by visiting his website, slowmedicinedoctor.com. Slow Medicine Radio is sponsored by the Slow Medicine Foundation, dedicated to providing community-centered, experiential, and reflective learning for individuals, families, and groups, offering educational programs, events, and resources, as well as insightful health evaluations with customized medical guidance. Dr. Finkelstein works with his wife, Robin Queen Finkelstein, at their farm, Sunraven, in Bedford, New York. And they invite you to visit and take advantage of this unique resource, including men's and women's groups and couples programs. If you think about it, much of what we experience when we don't feel well is a result of the fast world and how it affects us. Therefore, if fast is the disease, then slow is the medicine. Visit Sunraven, the home of slow medicine in Bedford, New York. Go to slowmedicinedoctor.com or call 914-218-3113. And thank you for tuning in Mondays at 5 p.m. right here on 1460 WVOX.
Welcome back to Slow Medicine Radio. I'm your host, Dr. Michael Finkelstein. And I've been speaking to you a little bit about addition by subtraction, I'll call it. Getting better by doing less. One is taking less medications, particularly those medications you don't need. But the other thing that we can do in our lives is, we're so busy, we're so frenetic, that some of the experience that we have is just being overwhelmed. And instead of adding more things to do, even though I advocate a smart way of eating and living your life, which might include adding more things on your calendar or having a different mindset when you go shopping and when you're preparing food, I really want you to also appreciate the value of just slowing down, doing less. So one of the things that we do when we invite people to our workspace at Sunraven is to give them that opportunity to just show up. and then other things are just there for you to flow into. Sort of like the way you might sink into a hammock. It's there. You got to do something strange to get into that position so you can fall down without hurting yourself. But then once you're there, you're just held into this really nice space, and you know how that feels. So think about taking care of yourself by doing less, not more. Although one of the things that you might add to your list is to show up at Sunraven on Saturday. Love to meet you. Call us, 914-636-0110 if you have a question. For now, let's continue the conversation a little bit by talking about the flu vaccine, which is something that I get questions about every year around this time, especially since the pharmaceutical companies start marketing the flu vaccine. And you see that in the form of pharmacy chains offering vaccination to the public. And many physicians recommend that as well and administer the vaccines to their patients. Typically, groups of people who get that recommendation are older people, people with chronic medical conditions that may make them more susceptible to infection or at risk for getting sicker if they were to get a common infection like the flu, and to very young children whose immune system, we are told, is not fully developed. And I say that in an intentional way, we are told, because one of the things that I think is important, and I say admittedly as a scientist, is what science knows and teaches us and tells us is based on what we know at the moment. And it's well-intended. People who are scientists care about discerning fact from fiction and helping people make better decisions with information. But the information is imperfect by nature, since we do not have the ability to know absolutely everything. There are things that we don't know entirely. And so we make what might be called educated guesses. And even the really good educated guesses often are not perfect. And so with the right advice, things still happen to people that they wish never happened. And part of that is the administration of medical interventions, whether that's medications, which have side effects, and sometimes those side effects can be severe, or vaccination. And so what I would say to you is, this is not an argument to never get vaccinated, by the way. We can have that conversation another time if you'd like. I don't know that I fall into that camp, quite honestly, though I can appreciate the conversation, and I can look at it with you if you'd like from both sides. But I want to really express that if you are relying on the flu vaccine to prevent the flu for you or somebody you know, then you're taking a chance. What I mean by that is really has two components. One is it may not work. So let's assume the vaccine is good and you won't have any side effects. But there's a chance that even vaccinated adults and children will still get the flu because there are many strains of the flu. And the vaccine contains several of those strains, but not all of them. And if one of the strains you happen to be exposed to is not covered by the vaccine, then you may not be protected. And the other possibility is that even with the right strain in the vaccine that you may get, your immune system has to respond to the vaccine fully for you to be fully immunized. And for many people, that same group of people in particular who are more at risk for the infection to begin with, are more vulnerable, often have something going on with their immune system that doesn't allow them to fully respond to something like a vaccine. So to rely entirely on the vaccine and say, I'm vaccinated, so no problem, I can do whatever I want, I don't have to pay attention in other ways, is taking a chance because you're not maximizing the likelihood that you're going to avoid the illness, or if you were to even get the illness, recover quickly and uneventfully. So what I assume when people get vaccinated is they want to avoid the illness, and if they don't, are unfortunate enough to avoid it entirely, at least if they get it, they get better fast. Now, if that's your interest, then you would then need to go one step further. What else can I do to help myself avoid the infection to begin with or recover more effectively? And that's where you get into slow medicine. Because the things that can be done to support you beyond the vaccine are the things that I talk about in terms of the way we live our lives. The food we put into our body, the words and the thoughts that cross our mind, some of which we are listening to from, out of the mouths of other people. There are other ways that we either move or don't move. Let's say we are tend to be sedentary and we decide not really to move our body. Then we're increasing our chances that flow, circulation, our immune system, our digestive tract are not going to be operating at their highest level. So that's a factor. Speaking of the gastrointestinal tract, it's not just the food that you put into it, but how healthy that tract is to digest and assimilate all the nutrients that you choose. And so things like medications, alcohol, previous injuries and infection, certain types of chronic conditions, all can impair how we digest and assimilate nutrients. And so that is an area that we can address. Then there's just this overall category of stress and the factors of pressure in our lives and the fast world and how it affects us, which is sort of the namesake for slow medicine, because if fast is the disease, as I say, then slow is the medicine. Well, this fast world and the intensity and the pressure is something that probably everybody I know is affected by at one point or another, and that has effects on the immune system. Some of the classic studies on the immune system take medical students who are a couple of days before an exam and determining whether or not they're more or less susceptible to common illnesses like oral herpes, just like a common cold sore in the mouth. And it's quite clear that stressed medical students are more likely to have an outbreak of oral herpes than they would at any other time. And so our immune system responds, sometimes not in the right, the ideal way, to that type of stress. So this is what you can do to couple with any other approach, including a vaccine if that's your choice, to improve your chances of avoiding the infection to begin with, or at least recovering well and uneventfully if you were to get sick. The fact is, if you were to do the other things that I'm talking about in terms of slow medicine, you might actually feel better about not getting the vaccine if you're on the fence, because you're now not feeling like you're just being helpless and uninvolved in your prevention, but that you're actually doing something quite active, make you feel much more positive in your mind and confident, and then you can live your life with less fear. The byproduct of the slow medicine approach to living is that all other things tend to improve, because when you follow those things, you rest more effectively, your mind is clearer, your relationships are incorporated into this project, and that you feel that your life in general is moving in the right direction. And it could all be because of this conversation that you were contemplating getting the flu vaccine or not. And what you realize is, no, if you take charge of your own health, then one, the vaccine may not be something that is so essential, but two, most importantly, that your life can improve because you see all these things that are really at your disposal. And most of what I just described doesn't really cost you anything. You don't even need to necessarily make a trip to a drugstore. You can just start living your life differently. You can choose how you eat, not what necessarily what's on your plate, because that I know for many people is a whole nother subject that takes some time to just really contemplate all the changes in what I'm going to eat, and I'm not going to eat this or that. And of course, people have all sorts of reasons why they resist changing their diet. But what about when you eat, even the food you're used to eating, you want to eat, and that's your way, but at least you sit down to eat and you relax while you're eating, and you create an environment at the table conducive to really digesting your food well, assimilating those nutrients, feeling at peace and harmony just while you're eating. Not changing your food just yet, but just for the 10 or 15 minutes you're eating, that you're not watching the news, that you're not answering the phone and then having conversations with people who are trying to sell you something. That you're at peace and at harmony just for those 2 or 3 times a day when you're eating. How much of a difference would that make? A great deal of difference. In fact, and if you did that, maybe you'd come to the realization that now you'd like to take another step toward the quality of the food that you're eating and starting to look at ingredients with a different eye about identifying what it is that you really enjoy, that you happen to also know is healthier for you, and avoiding those things that might be unhealthy for you. But now with this more positive energy and this more beautiful environment, you may be in a better position. Anyway, those are my thoughts for today. I hope that some of this comes across your mind as interesting enough to do something about it, because I don't want this to be sort of just an academic, interesting program, but one that inspires you to make a shift that moves you in the right direction. And I'll continue this conversation. Next week, in fact, one of my medical school classmates will be joining me. This medical school classmate is somebody that most people know of. His name is Dr. Mehmet Oz. He and I have been friends for all this time, and I've watched him as his career has evolved. Of course, much of what he does is highly public now, and some of what he does is interesting. Interesting because it really focuses on some of the conflicts that we have in our society in terms of this conversation about medicine and practice. And so he has a lot on his mind, I'm sure, that he can share with us, and we're hoping to confirm his appearance next week, but it'll be next Monday at 5 o'clock at our usual time. So thank you today for listening to Slow Medicine Radio. Again, this Saturday, you can come visit us at Sunraven for our Harvest Festival. In the interim, I wish you a great week, and well always.